So my name is Theoba Gondoza Luka. I'm the Chief Executive Officer of an organization called AfriAus Care. It's a culturally appropriate mental health organization. We mainly work with African community and people from other CODE backgrounds. During the past 3 years, we have worked a lot supporting the community because of COVID-19. So before we dive deep about working with public health and community organizations, I would like you to introduce yourself as well.
Okay, so Kate McGrath, or Catherine. So my role at Monash Health is Director of Community Engagement, and I've been at Monash Health for nearly 3 years. And before that, I was in the Department of Health and Human Services in Community Engagement and Population Health.
Wow, that's great, Kate, that we are able to talk this afternoon. So, how do you see your role of public health working with the community based on your experiences you have seen the past few years you have come here, but also today when you were talking about this new variant coming in the community about COVID-19?
So I think in terms of a team, so I lead a small team, but there's about 7 of us in the team. And really, in terms of sort of the community engagement, it is about strengthening connections with community organisations like AfriAus Care, really around kind of making sure that the public health messages are filtering through. So we know that, not everyone, listens to the news or reads the paper. That there's a lot of community leaders and community organisations where we need to work with to really then get the messages out on the ground. So that's really part of sort of coming here today, going to where community are and looking to link in so we can then connect on the ground and make sure that the messages are filtering through about how people can stay safe and protect themselves.
This is really good. When you were sending the message, you were talking to the community members just before and the students, people were listening attentively. And what has actually made me more happy is people were ready to get the paperwork that you were distributing so that they can take it home to show other people. This way, public health coming to the community, giving us the information, of course you gave verbally, but you also were prepared with paperwork. This is fantastic. I just hope you are going to continue to do the same.
Yeah, of course. I mean, I think, it might be COVID messages this time, but there are lots of other different things that might come up. So we also need to hear from community groups about what does work well. So, coming to a community lunch, or it could be some other event about how you sort of tap into to then kind of share the key messages. So I think, we're open from the public health unit side to really then work with community and work out what is best. Also thinking about translated material or utilising people who could sort of, translate or speak in language as well.
So the message today is about awareness of COVID is already there in our community. Some of our own community members have been sick already last week. Some are still sick. So it is real. The message from my side as a community elder is COVID is real. People need to be safe. Observe all the signs. If you are sick, stay away. Wear the mask. Open the windows. Just all what you have told the community, we just have to reinforce and reinforce. What's your last message to the community?
Yeah, I think, some of those key messages, I think it is really important, as you say, COVID is still with us. I think everybody's done a great job, in terms of the, where we have been, people really stuck together. But, there is, with COVID, it is still circulating. And so we do want to protect people who, who might be the sort of the more vulnerable or elderly, people who do have illnesses. So it's really about the little things people could do, like, as you said, like wearing a mask, staying at home if they're not well, knowing about things like the antiviral medicine. So, if they are unwell, they can get that early, so they're not going to be as sick. They're all the sorts of things, you know, that we can continue to provide. And actually had one person come up to me at the end to say, oh, there's some things in there that I didn't know about. So, you know, each time you probably also are kind of getting messages out that maybe people haven't heard before as well.
Yes, yes. So lastly, I would like to thank the Department of Health through the priority communities and also Monash Public Health for coming to the grassroots community. And you know what? The message is there. Everyone be safe. And thank you, Kath, for the time.
No worries. You're welcome, Silva. Thank you.